Yes, good afternoon, and I'm here today. Dr. Yaffe covered while I was away last week, and she's away this week, so I'll cover for her. And so I'm happy to report that today again, it's the fourth straight day in a row we have under 100 cases reported. So we have 95 new cases. Our total is 38,809. So that means, yes, we've had 4 days under 100. We had a couple days earlier over 100 in the below 150. So I'm looking forward to when we're going to get our first day under 50. We were there in the very early days of March. So we continue to move back on that as we see the different health units dealing with the issue. 29 of our 34 health units reported 5 or fewer cases. 14 had no cases for quite a period of time now. And we've had another 159 Ontario people have resolved. So that means 35,900. So 90% of our clients have resolved, and that's good news. Still one death, and we've seen our number of deaths over week over week decreasing. That we've had nearly 7 weeks with under 50 deaths reported in a week period, and we'd still like to see that number continue to drop even lower, of course. The last few days, most of our cases have been in Toronto. And again, we're dealing with small numbers, so it's under 100. Ottawa, Peel, and we've seen some in Chatham, Kent as well in that. And we're still doing a lot of testing. Well over 20,000 tests daily average. Yesterday we did 26,181. And our positivity rate was down to 0.5%. So that's been a couple times. We've dropped down to 0.5. We had one day where we dropped down to 0.4. And so that's even a more important issue as we're seeing this drop and stay down. We haven't had up to 1% in a long time. And we've bounced up a little bit to 0.8 and 0.9. But most of the time we've been down at 0.6 and 0.5. And so that's encouraging as we see that continually to decrease. Still, with that smaller number, we're seeing that the percent is highest in the 20 to 39 age group, but on an overall total amount, of course, that's 20% on, or that percent on a smaller number in there, but hardly any in our older age groups, as that has dropped off considerably. Yet our deaths are still occurring in that older age group, who, of course, are the ones that are more susceptible. So where are we at here? We're continuing to see our cases drop throughout the province. The ones that went to stage 3, first wave, is now, they're completing their 3rd week. So people are concerned, what are we going to see in those ones when they went to stage 3? We haven't seen a lot of changes, which is good news, because that means Ontarians are still being careful and cautious. We had concerns raised about bars and restaurants. We've done some changes in looking at that and watching that in there, but people are still being careful with their public health measures, mask wearing in public places, trying to keep the distance at all times, taking other steps of staying at home if they can, and hand hygiene is progressing and doing well. And that's what we want to see as we go through stage 3. The second wave group is now completing 2 weeks, and Toronto and Peel will be completing their week. And we still have to look at what are we going to do with our final health unit, that's Windsor-Essex. And the good news is that for the last couple of days, they have only had 1 case reported yesterday and today. So that is also encouraging to see that that's being contained and controlled. So we hope to be able to look at that and make some decision on that as we approach the weekend in there. So that's important to look at as we look at the August and how the community cases are coming down all around. We still have sometimes outbreaks related to a workplace or somewhere where someone has not been, or a group has not been vigilant with following all the public health measures. And it comes back and it resonates that those that said, well, I didn't think it could happen, and it does happen. And one only has to watch what's happening south of the border and other places around the world where they thought they had it down, and it's come back to repeat. And that's because when you lift, if you lift everything, you risk that. We're not lifting everything, even though we're opening up to stage 3. We're still asking for the public health measures in that. And some have asked, I know the Premier, about social circles, and we have not yet made a decision on that, whether we're going to increase the number of social circles or the size of them. although I listen to people and they're sort of doing their own, some of their variations, we want them to be cautious on that, because when we do have cases, do you know all your contacts? We do have the app out now, and it's in its first week of application and dealing with some issues and stuff. They're still trying to do that. And we're seeing how that's going to apply and assist as we monitor and do that kind of approach that we have done in Ontario. And I must say a majority of the population have done very well at keeping at the task and in doing this. So we want to keep looking at that as we look at into the fall with schools opening, college and universities, and other aspects, and as we continue to watch to see what the federal government would do with the borders, with international travel, and how we might make sure and ensure that anyone coming in has undergone the current federal quarantine rules and regulations to ensure that the work that we've invested in to bring the numbers down in Ontario can stay there. So in general, the messaging is it's going well. Everybody's doing well. There are some people that are still having some challenges in that, and the public remind them. And so we want to keep at the task as you get to see more and more things opening up, and opening up in a safe way, a contained way, a way that we can keep our numbers down. And as I said, I'd like to see our numbers soon under 50 for the province. I think it's achievable, and I think we can get there even, I'm hoping, even by next week. But we'll have to be patient and see how the going is in that regard, because as compared to the beginning of March, we're doing a lot more testing. We have a lot more capacity. And as I said, our positivity rate is coming down nicely to 0.5% and dipped a little bit lower one time earlier this week. So with that, I'm going to open up for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question.
Your first question comes from Michelle McQuigg with the Canadian Press. Please go ahead.
Hi, Dr. Williams.
Michelle?
A quick question for you about the school situation that we're finding ourselves in. There has been a lot of advice provided to the government, and they say that has been the basis of their action plan for education. Much of that advice has been calling for smaller class sizes and physical distancing measures within those classes, but that aspect is not currently included in the plan, at least at the elementary school level, even though many other aspects of popular healthcare advice are. Where do you stand on that issue? Do you feel that the government should revisit its education plan and try to take steps to implement smaller class sizes?
Well, right now we've been in consultation with the Ministry of Education over the last 2 months, even longer, looking at all the data that's coming in, the science and evidence that's coming in through various sectors, the various expert groups weighing in with information about what is the incidence of COVID-19 in younger children, children writ large, I should say, and younger especially. What is their transmittable potential in that? And we've seen some different data and new material coming in, but we continue to review it, continue to adjust to it, and watch it. The general messaging is that our incidence in that age group is very small, and testing of a lot of children so far has remained low. Our seropositivity on some of our tests, especially those under the age of 9, very low and almost like zero. So we're trying to understand how that works. We've been looking at, unlike some other provinces, saying, can we combine our principles that we've used in our general population? We have much more stringent activities in place there, such as cohorting. Can you have a cohort class of 15, 20, 25, that they could stay within that bubble, if you may? Much that with parents would know, okay, if it's grade X, they know what's in that class. They're going to be masking grade 4 and above. Some can wear them younger if they want to, and I've seen young children as young as 2 and 3 and 4 being happy with their mask. Some are not, and some will have difficulty with that. So we have to understand that and how that'll work. I think for a lot of people, as we're carrying out this discussion, and I think a lot of people are trying to work it through, and I get emails on both sides. Some are very happy to have things, some are very concerned. And I think part of that is this a social dialogue, because everybody, that means parents, students, teachers and administration are saying, okay, what are the issues? How do I understand it? How's it going to work? And how's it going to be implemented in our setting, in my community, in our school, in this type of setting where we don't even know the number of students because, as the Minister of Education said, there's going to be the capability of some parents decide to maybe not register their children into the schools this fall. So we don't really know what the sizes are going to be. The numbers, as you're seeing in the community, are coming down. If you don't have any cases in the community, it's very unlikely that the children will bring it into the school. And so far, it looks like the main concern is that will parents or older adults give it to children, yes or no? So that means those things about protection, maintaining your vigilance in doing as an adult or as a parent or as a teacher outside of the school, outside the classroom, is still going to be just as important. Much like we saw from some of the long-term care outbreaks, some of the staff actually, most of them, a lot of them picked it up in the community and some brought it in. And so we want you to be very careful with that, in that. So I'm still very concerned that adults, be they parents or teachers or otherwise, are vigilant outside the school in the community settings. And I think many are, and we're seeing that. That's why our numbers are coming down. So it doesn't mean we're going to be less careful. We want to be careful. We want to monitor that. That's why we put all these checks and balances in place that some other areas and other provinces haven't done. We're going to do the cohorting. We're going to do the monitoring. We're going to do the assessments, the community-based one. We're having a much more of a public health presence and linking with our enhanced public health force related to the schools and that, available to the parents, available to the teachers and the students, and how we're going to do that. So it has many more facets to it. And I think that's what you as parents and as teachers have to work through, because you're doing your own risk assessment, just like you're doing when you're going to stage 3. And you're trying to answer those questions in your mind, because you have to do that. You have to work that through. You have to ask those questions and be satisfied that you have the answers to those. And that's what we've done with our public at large, because this is the public response. And that's why we've seen Ontario's response, even with now, where we have a large percentage are doing masking because they have engaged in it and have made a decision to do so. And that's been a critical part of our Ontario response and the success therein. And the schools are just another phase of it. Again, we have to go through this process, we have to walk it, and we have to answer all those questions, try and get answers for you where the science is limited, try and get expert opinion, and try and advise the public writ large, especially the public of the parents, the students, and the teachers, so that they can be appraised and be satisfied with their risk assessment of the situation. And we hope to be able to satisfy that with the checks and balances we have in place. So we have been advised at the table. We will be advised at the table. We will be updating at the table with new science, new evidence, and new material, because this is all new. Things are changing, and we have to make sure that we are keeping everyone who needs to be informed of what they need to have to continually advise them on their personal, their child's risk, as well as their professional and functional risk in the school setting. So that's our endeavor as the health sector, to keep that active dialogue and that active updating going as we move through August and into September.
Follow-up?
Thank you. I have a question on behalf of a coworker who's working on a story related to schooling in more remote districts. Do you have specific guidance to offer on 2 issues? One is policies around buses driving children to multiple schools. Is there specific public health guidance you would want boards to implement or transportation companies to implement in those cases? And the other one would be mask use during recesses or lunch hours.
So we're trying to develop all those guidance documents. I know that the Ministry of Education has been working with the busing and the transportation side, with a number of steps being put in there about spacing on the buses, different routes and aspects, masking on the buses where it's appropriate. We're hoping that students in the transit side, both coming through the hallways and in the recesses, would be using masks at that time. In the younger grades, they would be more I would say cohorted in the if it's outdoor recess, and how to handle that so to keep them sequestered from the other students, where say some of the younger ones would not be able to wear a mask or not be willing to wear that, especially if you're dealing with JKs and SKs, but they're usually kept separate anyway. So there's many different components, because it's not all homogeneous throughout the province, and the Ministry of Education is developing in dialogue with those sectors on how best to do it, and of course boards of education and their own administration in each of the respective schools are going to have to look at the unique variables that they're going to face in that regard with sizes of classes and portables and different things. So very much a work in progress to try and get that to be the best advice to the most appropriate setting at the time in their circumstances and their locations. So it's not a cookie cutter across the province, but there are some general guidelines that the Ministry of Education is working on to put out to the boards and furthermore to the schools and various sectors.
Next question, and this will be the last question unless anyone else joins.
Your final question comes from John McGrath with TVO. Please go ahead.
Good afternoon, Doctor. We've heard some news this week from the federal government in terms of vaccine procurement, and I'm wondering what you can say at all at this point about Ontario's planning in terms of, getting vaccines pushed out to the public if and when they arrive. The flu vaccine can be distributed by pharmacists, but others are doctor or nurse only. I'm just wondering if there's any planning yet you can talk about in terms of how people would actually get a shot in the arm.
And it's a good question. Part of one of the advantages in Ontario is that we've had the universal immunization program for many years. And on a national basis, we do the most vaccinations of any province or territory. We have the largest population as well. But we have equipped our public health sector, our pharmacy community, our primary care, and our specialist community with various methods to roll out large volumes of vaccine such that last year we're broaching close to 5 million people. So we haven't, it's not that we haven't done this before, we've done it year over year. In that. And so you'd have to ask yourself on a population of 14, nearly 15 million, but 14 and a half, how many people would come forward for it? How many people would think about it? How do we do it? How do we make it available? And I can't see that the vaccine would come out at the same time as the flu vaccine, but it may be a sequel to that. And so we have many of those tools in place, and we want to make sure we're priming that up for that. If and when that does arrive, I think we're well equipped to step up to that and deliver that task, as we've been, in a way, undertaking it for many years now. And we're going to do, again, a real job of trying to enhance and even have more vaccine available for flu this fall. And so I think we're well prepared, but we can always do more, and we're always looking at all the different components and how we might ensure a quality, effective, and timely vaccination program if and when it's available.
Follow-up. This is the last question.
Has there been any discussion with the Minister of Education or the Minister of Health, I guess, about whether a COVID-19 vaccine would be added to the list of compulsory vaccines for students?
The mandatory vaccines are ones that you give, they're for a lifetime qualification. So, like, flu vaccine is not mandatory. It's voluntary because it changes each year. I'd be surprised if COVID's going to be like an annual one at this stage. I'd be surprised if it was, but let's see what happens. But the ones we're talking about, usually the childhood vaccines, the ones for measles, mumps, rubella, chickenpox, pertussis, there's various ones for other ones that are part of the childhood series that equip them for longer-term life immunity that are useful as they go into the school world and beyond that, and then later adults have their own ones that are, like your regular tetanus and your one-time diphtheria boost and that one. So there's various ones that are there for adults as well. So at the moment we have not planned to add it as a regular because we haven't seen it yet. And we have to understand what that is. And with flu vaccine, it varies from year to year in the content. So we haven't put that in as a regular one, mandatory requirement. It still is voluntary, but we're hoping that more parents will consider having children done again this year with the flu vaccine. And then once we get the COVID-19 vaccine, we'll have to see what the monikers are for that from the manufacturers and the various requirements and stuff and how we would implement that. So still a lot to be determined yet.
Thanks, everyone.